Hi, welcome to Math 119-312. This is the last of the presentations. If you haven't done the homework, the writing assignment that is due today, if you have a homework exemption, you're welcome to use that. Friday's class will be on just general discussion from what we've done and seen throughout the semester. The exam is due then unless you have asked me for an extension. And I will now turn it over to COVID-19 policies by country.
So we will be bringing you guys through the different COVID-19 policies of various different countries around the world. So just a brief overview, these are the countries that we'll be going over. We chose these because we felt like it gave a nice holistic view of the different policies that were enacted and the current state of different countries. So the main topics that we will be bringing you into are some of the major timeline of different events that have occurred, the various different policies that were enacted in those countries, and then the current case and death toll of the countries. So I'm going to be bringing you through New Zealand's policy. So just to begin, some inherent benefits that I would like to go over are first that this, it's a remote island nation, so very few flights will travel through it, making it easier to close their borders. Next, New Zealand is on the smaller size. There's just under 5 million people, so a smaller number of people makes it easier to keep the disease down. And then finally, they have a central governing system, making the enforcement of policies easier. So this is a timeline of some of the major events that occurred. So in the end of January, New Zealand started preparing for this disease and monitoring it. On the 28th of February, New Zealand had their first reported case of COVID-19. And then on the 21st of March, the government introduced a 4-tiered alert system to help prevent the spread of the disease. On the 29th of March, they had their first reported death. And then on the 4th of May, that was their first time they had not had any reported cases. And from the 7th of October, they've been at a level 1 alert. So these are the different policies, alert levels that they have put into place. So alert level 1, they labeled it as prepare. They were trying to keep the disease contained in New Zealand, so just initial travel restrictions. Alert level 2, they reduced they labeled it reduced. The disease is contained, but there's a risk of community transmission. So they were implementing non-pharmaceutical interventions, as well as an initial gathering ban. Now on alert 3 was restrict. This was high risk. The disease is not contained. This comprised of more movement restrictions, including stay-at-home orders. They had enhancements of their contact tracing, testing, isolation, and quarantine. Alert level 4, this was when travel was severely limited, all gatherings were canceled, and all public venues closed. All of these things are cumulative, so they just build off of each other. Just a brief overview of testing in New Zealand. They've had over 1 million tests administered. And then in May, the 20th of May, they released their COVID Tracer app, which allows users to scan a QR code at various different points of entry in different venues. So this helps contact tracers to review where a potential infected person has entered so that they can better track who might have been exposed. So this is a graph showing breaking up into their phases and alert systems. And it shows that they were able to flatten their curve relatively quickly. They had their initial spike in March, and then with their different non-pharmaceutical measures and testings, they were able to really bring that curve down and flatten it. And ever since, there's been, as you'll see in the following slides, there's been very few cases reported. This is just another graph showing the same thing, but with their different measures they've taken and implemented. Currently, they just have over 2,000 cases and 25 deaths. So this is as of December 5th. So they've been able to control the disease pretty well. They acted swiftly and decisively during the early stages of the breakout, as well as the citizens have adhered to the rules. They've had widespread testing and contact tracing, and the government has had good communication, which has been key to the success. So now I will shift it over to Sarah.
So next we're gonna look at Australia. They've also done exceedingly well, similar to New Zealand. So we're gonna look at their policy and timeline. So the first confirmed case was on January 25th, and soon after they denied entry to anyone arriving from mainland China. And about a month and a half later closed all their borders to non-residents. And by early April, cases started to fall, and by May, the curve flattened. But then a second wave of infections came about in Victoria, the state in which Melbourne is, which imposed another set of lockdown measures, and a state of disaster was declared. But eventually cases fell again, and on November 1st, they claimed 0 new cases and 0 new deaths nationwide for the first time since the beginning of June. And by November 27th, there were 28 consecutive days without any new infections or deaths, which by the CDC is the definition of eliminating COVID-19 from the community. So the policies that were effective in Australia include the lockdown measures, contact tracing, travel restrictions, and testing protocol. First and foremost, similar to New Zealand, the residents of Australia complied with the government measures and restrictions very well compared to a lot of other places. So their lockdown measures included a curfew and stay-at-home order, where police could spot check you if you were out past curfew and didn't have a work permit, and write up fines. They also wrote fines for not wearing masks at times when the lockdown was strict. And then they created a contact tracing app, the government did, and really focused on speed in terms of contact tracing. So they tried to get all contacts within 24 hours of a positive test, which allowed them to contain the virus. And then the travel restrictions, they closed the border in March with a mandatory 14-day quarantine upon arrival for all citizens. But that quarantine was mandated and regulated as they rented out hotels to put the residents in rather than just telling them they have to quarantine for 14 days. They also banned their citizens from overseas travel, and there was minimal travel permitted across the states in Australia, which helped contain the virus when it broke out again in the second wave in Victoria. And then their testing protocol was very effective and widespread. They had over 10 million COVID tests so far with a 0.3% positivity rate, which is relatively low compared to other places. And as you can see here, the first graph shows a timeline of border closures with the number of cases. And then the second graph shows the stay-at-home order regulations in line with the cases. So here we can see the number of cases by state in Australia. So Victoria clearly had the most cases given that they were the epicenter of the second wave. But something interesting to point out is the contact tracing measured by this graph. So as you can see, most of the cases were effectively contact traced with a known contact or overseas acquired, which this contact tracing was effective and helped them contain the virus as well. And the total number of cases in Australia was about 28,000 with about 900 deaths so far. And in Victoria was about 20,000 with 820 deaths. So it shows it was very concentrated in Victoria, but also not a ton of cases compared to their population of about 25 million. And the first graph shows the total number of cases. So the first wave was widespread over Australia, and then the second was mostly in Melbourne and Victoria. And then the second graph shows us the total number of deaths in Australia. So overall, Australia has done very well relatively to combat the virus, and a lot of this is due to their strict lockdown policy and contact tracing and border closures. But also the citizens' willingness to comply to the rules imposed by the Australian government. And that's it for me.
All right, so now we'll talk a little bit about South Korea and their measures. And all right, next slide, please. So on January 20th, they had their first confirmed COVID case, and it took about a month for them to have a lot more, which is when they had 30 cases. Then about a week later, they decided to close all their schools, which is odd, though, that it took them another month to place stay-at-home orders. And then about another month after that, because of the stay-at-home orders and all the measures that they put in place, they were able to relax some of the social distancing practices and then begin their reopening process. So on May 20th, after about a month of getting all the measures in place necessary to safely reopen, they started opening their schools, which went well for a little while. And then they had a couple spikes here and there. But with the recent uptick in cases in South Korea and across the world, they decided to go back to mandatory mask wearing and stricter social distancing practices. So the three things that they tried to hone in on to contain COVID was the social distancing, their testing, and their contact tracing. And for almost a majority of the COVID outbreak, they've been able to keep R0 under 1.0 for a majority of the time, with the exception of a couple localized clusters that caused R0 to go up and down. The contact tracing accounted for a lot of COVID cases. It was almost 66% of all confirmed cases, similar to some of the other countries that found that a lot of their confirmed cases came from contact tracing. Next slide, please. And here's a graph of R0 from about mid-April to mid-July, and you can see how the measures that they enacted early on dropped R0 pretty close to zero. And then with the exception of a few outbreaks in localized clusters, which caused R0 to skyrocket, they've done a pretty good job of keeping it at a safe and contained level. Next slide. So here's South Korea's current COVID totals. Some of the major spikes outside of the early uptick when COVID first outbroke are due to the localized clusters that resulted in some of the spikes in R0, and they're kind of small between April and August, but after that there was another big localized cluster that outbroke, and then towards November is where we see the large increase in cases that's a result of the second wave that we've seen across the world. South Korea's only had about a little over 500 deaths and almost 40,000 cases, which is not as much as some of the other counterparts, especially compared to their population. Next slide.
I'll be doing Canada. Next slide, please. So just a bit about the timeline. So on January 27th was the first confirmed case in Manitoba. It had come from a male who had been traveling in Wuhan. Then March 4th, Prime Minister Justin Trudeau announced the creation of a committee to start the federal response. And from here, on March 11th, he announced a $1 billion response fund, which included $500 million going to provinces and territories, $50 million a donation to WHO, and $275 million to fund research in Canada. Then just a little side note, a couple days later, the Prime Minister's wife announced that she had contracted COVID-19. Then on March 18th was the closure of the US-Canada border and implementation of a travel ban, which meant anyone entering the country had to self-isolate for 14 days. Then on April 6th, Trudeau announced the Canadian Emergency Response Benefit, which included wage subsidies, loan aid, mortgage delays, etc. Then on April 10th was when the RCMP, which is the Canadian Federal Police Force, began to enforce the Quarantine Act 2005, which included penalties for violations of these policies that they have set in place. Then a couple days after that, Parliament reconvened and passed Bill C-14, which was basically just an updated response act to the Quarantine Act. Then on May 1st was the implementation of the Canadian Emergency Student Benefit, which entailed $2,000 per month for secondary school students who weren't able to find work. On June 18th was when Canada hit 100,000 cases. Then on September 23rd, Justin Trudeau announced that Canada was in its second wave. On July 23rd until November 23rd was the creation and then subsequent burst of the Atlantic bubble, which I'll discuss more in the policy slide. And then just on the beginning of the week, Trudeau had announced that there will be vaccines arriving before the end of the year. Next slide, please. So as of yesterday, December 8th, there was a total of 426,000 cases with 12,000 deaths. 70,000 of these cases are currently active. So these graphs represent the rate of cases and deaths per 100,000. Just to get a sense of how Canada is doing comparatively, they rank 73rd for the rate of cases per 100,000, whereas the US was 10, with number 1 having the highest rate. And then for deaths, Canada 46 compared to where the US was at 13th, again, number 1 being the highest cases. Next slide. So here I broke down the cases and versus rate of case by province because I'll go into it a little more in detail in the next slide, but Canada didn't enact any policies federally. They did it province by province. So it's just interesting to note here, when looking at the total cases versus the rate of cases, there's significant difference in some province because they have smaller populations. So for example, like take a look at Nunavut. So it's in the top right. They are in light blue in total cases, but since they have such a small population, they're in dark blue for rate. It's important to note that. And next slide, please. And this is the same, but just for deaths. Again, interesting to note, there's a significant difference with some province because they have larger populations. So for example, Ontario and Quebec, they're the 2 biggest provinces around the middle. They're in darker blue for totals, but since their population is so high, when it comes to rate of deaths, they move down to a lower level. Next slide, please. So as I mentioned before, the policies ranged because the federal government didn't enact anything specific. Rather, they worked with each province and territory to put in place what was necessary. So just for example, I'll tell you what happened in Nova Scotia. So they were a part of the Atlantic bubble, which consisted of the four most east provinces. And so what the bubble meant was that anyone entering these 4 provinces had to isolate for 14 days. But once you're in the bubble, you could travel within these 4 provinces. This subsequently just burst the other week because Nova Scotia and New Brunswick had seen an increase in cases. But so other policies that were enacted within Nova Scotia, they had a lockdown earlier in the spring. Then currently right now they're in less of a lockdown, but still a little bit of one. Masks are mandatory. There's social distancing, limited gathering, so certain numbers that could be indoors together and outdoors together. There is contact tracing, so any confirmed case is contracted right back to the source, and there's increased testing. And then it's just not federally enacted, but it's important to note that masks are now mandatory in all provinces.
Okay, so I will be discussing the timeline and policies in Japan. So on January 16th, Japan had their first confirmed COVID case. And then on February 3rd, the Diamond Princess cruise ship quarantined in a Japanese harbor. which was significant because it was one of the first major outbreaks. And although the cruise ship did quarantine, some cases slipped by and the individuals spread it to mainland Japan, which was obviously negative for the country and their goal of keeping the virus out of their borders and contained initially. On February 13th, Japan recorded their first COVID death, and on April 17th, a state of emergency was declared to the entire nation. Shortly after, the number of active cases reached 10,000 for the first time. And on May 25th, the Prime Minister announced the end of the state of emergency because things were looking up in terms of number of cases. And shortly after, the Chubu Centrair International Airport resumed its international flights on June 16th. However, only about a month later, on July 20th, the official number of COVID-related deaths in Japan reached 1,000. Despite this, the government announced that it will reopen borders for all foreign visitors with permits to stay in the country on September 25th. And then on October 1st, the Tokyo Center for Infectious Disease and Control was established in order to learn more about the pandemic. So in terms of Japan's policies, wearing masks and other sanitary measures such as bowing in the form of greeting rather than shaking hands has been custom in Japan for quite a while. So when the COVID pandemic hit, they were prepared and there was no backlash against wearing masks. And the Japanese government also sent masks to every citizen in the mail in April. Unlike other countries, Japan never imposed a mandated lockdown, but rather encouraged and asked people to avoid crowded indoor spaces, wear masks, and practice social distancing. So they were more focused on educating the public rather than enforcing a lockdown. Japan is an island, so they were able to enact travel restrictions that made it easier to keep the virus under control. However, Japan is a small country with a high population density, so 50% of the population lives on 2% of the land in cities like Tokyo and Osaka. So people living in very close proximity to one another like this is a breeding ground for COVID, which is what you see in the map with Tokyo having almost 5,000 cases as of May 6th, while other prefectures had 0 or 3 cases. And although Japan's testing has increased significantly throughout the pandemic, they started out only testing the symptomatic and severe cases, providing a greater emphasis on contact tracing. And Japanese contact tracing was rather innovative on the global scale because instead of identifying who the infected individual could give the virus to, they were more focused on where the infected individuals got the virus from. And they discovered that in most cases, transmission occurs through specific super spreading events. In June of 2020, Japan released their contact confirming application, which notified users if another user with whom they shared 15 minutes of close contact with had reported that they tested positive for the virus, which obviously this app had flaws because not all citizens had the app and not all reported a positive test or even got tested in general because, as I mentioned previously, Japan had low levels of testing. The next slide. So as far as cases, as of December 6th of 2020, Japan had 160,098 total cases and 2,315 deaths. So relative to the rest of the world, these numbers seem as if Japan is doing pretty well. They spiked in August with number of cases, but their deaths in August were relatively contained. However, more recently, Japan spiked again with 2,585 cases on November 29th, and then 43 deaths on December 5th. But again, because of the low levels of testing in Japan, they could have had a very large number of asymptomatic cases that were not being reported and may still not be reported. So these numbers could be inaccurate.
So hi everyone, I'm going to tell you a couple of things about Germany. Always keep in mind this location and the map of Germany where it is in Europe. Next slide. So a couple of big things that happened in Germany when it comes to COVID. The first registered case was on January 27th, and it was related to tourists that were coming back from Wuhan. The thing that the German federal government did immediately, they created a specific quarantine area for anybody coming back from China or any other place that they deemed as might be COVID. A problematic place in the sense of COVID. Testing began immediately, even though it was limited, and something that the Germans did, which is kind of interesting, they started calling the disease a pandemic almost immediately, quite early on, so at the beginning of February, and they created a federal COVID crisis team somewhere around like the mid-February, around like February 15th, February 16th. Next slide. So in March, they started sort of lockdown. The German government did their best to not actually call it a lockdown. They were just trying to incentivize people to stay away from each other, to keep distance, and also to wear a mask. There was never an official mask mandate in Germany up until October when it got a little bit worse, but we're going to get there. When it comes to, in general, the German philosophy, the idea was that they were going to prioritize health over the economy. And this is kind of like the stuff that was going on in March. They had a partial lockdown when it comes to schools. They shut down a couple of schools, but then they actually decided that they were going to let each state government decide whether or not they want to keep their schools open or close them. And they massively prioritized med students, which is also kind of interesting. Next slide. So the situation was pretty stable when it comes to May. So they decided to slowly reopen the country, and they started off again having their soccer tournaments. All the way throughout the summer, the situation in Germany was very stable. And what the German government could do is they could focus on planning out vaccination and creating some new COVID warning apps. So they really focused on contact tracing in a similar manner like Japan did, except that they had significantly greater amounts of testing, which we'll see in the slides that follow. When it comes to the current situation in Germany, they started getting a little bit worse in October, and they are currently in a lockdown which will last all the way to December 20th. And something that's kind of interesting to me, at least, Germany actually has their army ready to enforce the lockdown if deemed necessary. Next slide. So major policies, they kind of varied from being very severe to being very low-key. At the moment, there is a partial mask mandate in Germany. In certain places, you have to wear a mask, and you can be fined if you're not wearing a mask. If other places, they don't care that much about it. Every German citizen who wants to get tested can get tested, and they have a huge amount of testing. There is a partial travel ban into the country because of the spike that was caused after tourists started coming back from the summer in October. Next slide. So as I said, current situation, not too bad. There's about 320,000 cases, only 1% of them are severe. Total deaths about 18,000. And again, they're just trying to build a better COVID warning app at the moment. So next slide. So when we compare Germany, how it did in the beginning and how it's doing at the moment. So the first spike in Germany wasn't too severe. It's just noticeable around April. Then it completely dipped around throughout almost the whole summer, and then it got a little bit worse in October, and then it's just started spiking massively. And we can actually notice that Germany is doing a worse job handling the pandemic now than it did at the first spike. Next slide. The same thing goes when we're looking at new deaths. So interesting, in most countries, the new death rate is comparable for like the multiple spikes that happen around COVID through the first wave and the second wave. In Germany, you can actually notice that it's almost twice the rate for the second spike as it was for the first spike. And again, during the summer, there was virtually no COVID. Next slide. So on the left, you can see a graph showing how many tests Germany has provided their citizens with on a weekly basis. So about 1.5 million tests on a weekly basis, and about 9% of those tests end up being positive at the moment. Next slide. An interesting question is to see how flat the curve is in Germany. Specifically, the slide on the left is showing how many intensive care units are used in Germany, about 4,000 for COVID patients, which represents at the moment about only 15% of the total number of intensive care units available for the German populace. Next slide. And here there are a bunch of slides normalized per population, so per 100,000. You'll notice that Germany is, when it comes to new cases, doing significantly better than some countries, but also worse than others. For example, it's doing way better than the United States, but worse than Canada and Australia. Next slide. When it comes to the new death rate in Germany, it's actually kind of comparable to the United States, yet it's still a little bit better, but obviously it's kind of worse than it is in Canada. Next slide. But obviously, if you look at the total death count in Germany and the United States, it's obviously way smaller for Germany than it is in the US. And next slide. So forward, they're working on getting their vaccine approved. They're probably going to use the Pfizer vaccine. They're focused on creating vaccination centers. And again, geography is a big problem because Germany is so central in Europe and it has so much contact with everybody. And there's just a little bit of info in a Google Doc about if anybody wants to read more. And
okay, so I'm going to be taking you guys through the course of the pandemic in the United States. Next slide. So January 20th was the first confirmed case of COVID. And after that, obviously, there were large spikes and it didn't take long for the virus to spread. So on January 31st, Trump restricted travel from China in an attempt to kind of prevent the spread. So on February 29th, that was the first reported COVID death in the United States. And then by March 13th, Trump had declared a national emergency. And then March 15th, the CDC recommended limiting gatherings to fewer than 50 people, which obviously when you provide a recommendation like that, a lot of people will continue to not follow it. So then on March 27th, Trump signed a $2 trillion stimulus bill in an attempt to kind of combat the spread of COVID. And then on April 2nd, nearly 10 million Americans were out of work, which shows the devastating effects on the United States economy. And then by May 27th, over 100,000 coronavirus deaths had occurred in the United States, which just shows like how rapidly the virus spread and how many people were affected by it. Next slide. So another interesting event to note, by May 31st, that was kind of when the Black Lives Matter movement gained momentum. And there were many protests over police violence, which obviously involved like many crowds gathering and protests. And a lot of people were predicting that this would cause prominent coronavirus surges, but it actually did not. So that was really interesting to note. So by July 7th, Trump announced the United States withdrawal from the World Health Organization, which there's a lot of controversy surrounding that. And a lot of people disagreed with this decision, obviously. So then July 11th was when Trump wore a mask in public for the first time. And I thought that this date was interesting to note because obviously it was so delayed, which kind of just shows like the lack of action from prominent political figures. And it just, it also kind of contributes to the idea that like when political figures aren't setting a good example, other people aren't really gonna follow proper safety protocols. So then on July 13th, by this point, more than 5 million Americans had lost health insurance, which obviously is devastating. And then by July 27th, Moderna vaccine entered phase 3 testing, which was a little spark of hope that maybe we could get beyond this at some point soon. And then August 23rd was when the FDA authorized the use of convalescent plasma from recovered COVID patients to treat new cases. And this was huge because it was kind of like another piece of hope, and it definitely led to more recovered cases. So that was definitely a big discovery. Next slide. So by August 30th, the US reported 6 million COVID cases. And then on October 2nd, Trump announced that he and Melania had tested positive for COVID, which was not surprising given the fact that they were not following important safety protocols. So then on November 16th, Moderna announced its vaccine candidate, which was 94.5% effective. And then on November 18th, Pfizer announced that its vaccine would be submitted for FDA approval. So this was kind of like the first step that showed that we were really quickly moving in the right direction. And then on December 1st, Moderna submitted its vaccine for FDA approval, showing that perhaps we would have more than one option for a viable vaccine. Next slide. So going into some of the United States policies, these mainly included mask mandates, travel restrictions, and stay-at-home orders. But a big problem with the United States was that there were a lot of inconsistencies within states, and it was really like left up to the individual states to decide how strictly they were going to enforce these or what they were really going to implement to begin with. So for mask mandates, each state has established different procedures. So the most common forms of mask mandates, which really differed amongst the states, included requiring masks only like whenever you left your home, which was obviously the most restrictive part. And most states did not implement this, or citizens simply did not follow the restriction. And another kind was just requiring masks inside public buildings or businesses, which I think was probably the most common type of mask restriction. And then other states required employees to wear masks when in close contact with customers. So it really differed by state. And in terms of travel restrictions, most states required a 14-day quarantine period upon entering, but this was really difficult to enforce. And a lot of states didn't really provide concrete, they like didn't make people provide concrete proof of this. So that was not a super effective travel restriction. And then some states actually only required this 14-day quarantine period for citizens of particular states. For example, like if one state was experiencing a surge in cases, then other states might require citizens from here to quarantine before entering. So a few states required negative test before traveling, but this was also very rare. So in terms of stay-at-home orders, this also varied by state. And one of the kind of like main stay-at-home orders sort of like restricted people to staying in their homes and closed a lot of businesses except for essential businesses, obviously. But one problem with this was that different states employed different definitions of what it meant to be an essential business. So it was kind of hard to determine when each state was sort of giving different definitions of this. So some states have implemented stay-at-home orders while others have not at all. Next slide. So here is kind of a graph of the course of the pandemic from the beginning to now. And you can kind of see the different like surges and then when it dies down a little bit. And obviously you can see right now that there are more cases than ever. And there's obviously a huge spike. And a lot of this has been attributed to the holiday season and people gathering in large groups with family members and traveling. And also kind of like the COVID exhaustion where people are sort of beginning to give up on following safety protocols because they're tired of it and they want to get back to normal life. And also obviously the huge push to reopen the country for economic purposes and also just because people want to get back to normal life. Next slide. So the total case count in the United States is up to 15.1 million as of yesterday. And the total deaths are 285,000. And then the active cases right now are 6,211,242 as of yesterday again, but obviously they increased by today. So this just kind of shows how many people have been affected by this, and 285,000 deaths is clearly very significant. Just sort of shows that this is like a super prominent and devastating virus. Next slide.
All right, China. China has currently 86,000 more cases and 4,000 deaths. First case, December 31st, 2019. So it's called COVID-19, so not COVID-20. And first death, January 11th. And January 23rd, Chinese closed out Wuhan was probably the origin of the virus. And at the end of January, WHO declares global health emergency and Trump banned travel from China. Next slide. Early response, so they played it down, saying there's initially no human-to-human transmission, but then after they say there's limited human-to-human transmission, and they close out Wuhan and they say, okay, there is actually human-to-human transmission. The first case is found in the Hunan seafood market. It was quickly shut down and cleaned after. They shared their genome sequence of COVID with the rest of the world in early January, but they destroyed their lab samples for quote-unquote biosafety reasons. And they silenced the whistleblower Li Wenliang in late December through when he sent message through WeChat, and he later died due to COVID-19. Though later China apologized and honored him as a martyr. Next slide. And so he was the whistleblower, and the local police station sent him a letter of admonition, so forcing him to admit that he spread rumors, which is actually doesn't make sense. Okay, next slide. Just before shutting down, because of the Chunyun, which is during Chinese New Year, there's mass migration around China. So before they closed out Wuhan, 500 million people actually left the city. So people question if it's actually really effective. And while quarantine, instead of a COVID stimulus check, their local government did a form of consumption coupons worth of $70 million roughly. Next slide. So here's a example of the coupon. So you go to WeChat with it's like a messenger in US, which for example, they have a Pizza Hut coupon. If you spend 10 or more, they'll give you $3 coupon. If you spend 24 or more, they'll give you $8 coupon. Next slide. So from February, April, there's a major spike in China. So it's initially from Wuhan, then spread to the rest of China. And at end of March, around there's 80,000 cases and around 2,900 deaths. And at that time, they also suspend other people from coming to China. And around April, things start getting better. So Chinese government reopens Wuhan. And next slide. So daily cases, you'll see a weird spike in around February because they changed the testing method to lab diagnosis. So if you have COVID-like symptoms, because they have a test shortages, if you have the symptoms, they will assume you have COVID and treating you accordingly. So that's why that's the spike numbers come from. Next slide. Here's the death count. So basically, after April, there's pretty much no death at all. But weirdly, around April, there's a spike, but it's not really a spike. It's the public official readjusting the death toll. People say it's suspicious, but they say they are they're coordinating all the data with all the hospitals. So that's why you see a spike. Next slide. So until today, there's still very small spikes in some parts of China. And during August, it's actually very early, they announced they have their vaccine and it's approved by China CDC. And they say it's effective and they are giving their vaccine to other countries, yet they didn't provide enough clinical data as like Pfizer and Moderna did in US. So we don't really know if it's good. And today we have, as I repeated before, 86,000 some cases and 4,000 deaths. And the newly confirmed cases mostly come from overseas. Next slide. The policies are actually pretty brutal, but it's also pretty effective. So during late January to early April, Wuhan was shutting down and all transportation closed, schools on break, shops are closed, and numerous Fangchang or makeshift hospitals were built in Wuhan for handling mild patients. So that's one of their strategies. Next slide. Yeah, so for example, they can convert the whole stadium into a hospital with hundreds to thousands of beds. So to have mild condition patients, so to not overwhelm the hospital. Next slide. They also built 2 hospitals with ICU beds in 10 days, which is pretty impressive. And they also mandate universal masks and lockdown. But their strategy is comparable to the US stay-at-home order, but it's much more stricter. Various measures taken to force people to stay at home. Next slide. There's police coming, locking the door from the outside so people cannot get out. That's one of the ways. And the next slide. Hotels and schools are converted to isolation centers. Confirmed people have to move to the hotels for at least 14 days. Similar lockdowns were taking other parts of China. Next slide. So their strategy is if you find some cases, they'll test the whole city. So after the Wuhan spike, they test everyone in Wuhan. After the Hong Kong spike, they test everyone in Hong Kong. You get the idea. Next slide. They are currently relaxing mask mandates, though everyone still wears masks. And traveling to China was still subjected to mandatory testing and quarantine for 14 days. And they still see why universal testing, there's a spike. And that's all for China.
So in conclusion, what can we actually learn from this cross-country comparison? So the factors that you see on the PowerPoint right now, those are all hugely influential factors that decide, I think, based on our analysis, how countries did during the pandemic. So concerning the timing and the length of lockdown, New Zealand's alert level escalated from 1 to 4 in just 5 days when their case count had barely passed 1,000. And so lockdowns implemented later on tended to be less effective and came with bigger trade-offs between health outcomes and the economy. This is seen in Melbourne, where a lockdown was declared in August that lasted over 2 months because of the inability to bring down the daily case count. So overall, countries with longer lockdowns saw lower case counts, but whether or not a full or partial lockdown was implemented seemed to have less to do with the case count than the mortality rate. So the implication of this is that full lockdowns are more effective, not because they curb the spread, but because they lessen the severity of the peak transmission, which prevents the overloading of the medical system. So now onto testing and health capacity. So widespread testing capacities, especially early on, allows for very informed policy decisions. So again, as in the case with New Zealand, they were able to conduct large quantities of tests early on in the pandemic, and consequently, they were able to quickly identify transmission chains and bubbles and implement contact tracing, etc. Testing capacities also allow for real-time calculations of R, which, as we've seen, is very important factor that influences policy decisions. Now, concerning healthcare capacities, Germany had an average of 34 critical beds per 10,000 inhabitants pre-pandemic, so roughly around 3 times that of Spain. And so this, for a large part, allowed them to keep mortality rate at a relatively low and stable level. And the obvious implication of this is that investing in the healthcare system's capacity helps to prepare a country for future pandemics. Now, concerning the easing of lockdowns, countries with clear criteria for easing lockdowns that were informed by data and expert opinion tended to do better. And of course, this is very closely tied to an individual country's testing capacity and how well its economy can sustain lockdowns. On the other hand, easing lockdowns too early, which was the case with Georgia in April, benefits neither the economy nor public health outcomes. And across the US, states that opened their economies early tended to do worse. Onto mask mandates. So early on in the pandemic, there unfortunately were a lot of mixed messages sent out from organizations like the WHO and also individual governments about the effectiveness of mask wearing. However, countries that either instituted mask mandates early on, such as Singapore, or had mask wearing cultures, such as Japan, saw generally better outcomes. Now, concerning pre-existing demographic features, there was a cross-country analysis that was published in the Lancet that concluded that demographic features such as obesity and also per capita GDP had very strong and positive correlations with the death rate per million. Factors, on the other hand, like income dispersion and smoking prevalence were negatively correlated with death rate. So the implication of this is that countries must take into account their own demographic data rather than blindly following other successful countries' policies for future reference. And it also follows from this that a more detailed study is warranted to assess the impact between various demographic features with the pandemic to make better informed policies in the future. Finally, as we mentioned during previous presentations, countries with collectivist cultures and traditions, such as Japan, tend to do better during pandemics. The Japanese government's mild, non-stringent lockdown, for a large part, was able to produce effects that were similar to those of a real lockdown, largely due to the fact that people were complicit with the government's requests. Next slide. So for anyone who's familiar with statistical analyses and actually wants to carry out a statistical analysis, you can go to this link, which has a lot of data on, the timing that countries instituted lockdowns, other health measures between various countries, and it's very easily transported into data or R. So this is just out there for anyone who is interested. That's all. Do we have any questions?
So thank you. We have time for 1 or 2 questions. So I will ask one. When you look at the death rate across countries, do you know if each country has the same definition of a death due to COVID?
This is actually one of the tricky parts conducting a statistical analysis. Not only, you have to worry about a range of factors, right? Whether or not a country has the incentive to actually correctly report their data, or there's a lot of leeway, I think. There was analysis that I read, the countries like Belgium were much more likely to attribute death to COVID, while other countries, due to other reasons, might have either accidentally attributed death from COVID to, let's say, the flu, which was the case with a lot of countries early on. But I think overall, across the board, at this stage, this is less of a concern.
Thanks. I was almost wondering if you might be able to sniff things out by looking at the number of reported new cases and trying to see how that correlates maybe with the death rate. But of course, if people start adopting good policies such as protecting the most at-risk populations, that's going to change all the correlations. So thank you. Did anybody look at Sweden at all in the group?
We actually weren't able to get to that due to time restrictions, but we do know that they had a rather interesting policy, especially early on. They largely had a laissez-faire attitude, I think, and was somewhat effective, comparatively speaking.
Right, and now there's some questions as to how well is that policy working long term. Oh, thank you again for the presentation.